is Jillian Janess, and today I'm going to be talking about May-Thurner Syndrome. And I don't expect you to know what that is, but it's a very uncommon thing, and when they told me that I had it, my doctor said that they had only ever heard of it in textbooks. So, that tells you anything. Alright. What could cause me, a healthy teen, to need to be revived for around 2 hours? The syndrome I will describe to you today was the reason for my first trip to the hospital. In the article, acute bilateral pulmonary embolism in a 21-year-old is May-Thurner Syndrome and are differential by R. Badra in 2019. They explain that May-Thurner Syndrome is a clinical condition where the left common iliac vein gets compressed by the overlying right common iliac artery, anterior to the fifth lumbar vertebra in the sacral promontory. It results in vessel wall injury and predisposition to thrombosis. And the pressure that the artery puts on that vein kind of compresses it back into your spine, so there's no blood flow. And the artery has more pressure than the vein, and it's able to put more pressure onto the vein than the vein can push back. And so that causes a blockage. And this blockage causes the blood to stop flowing through the left leg at a healthy rate. And when that blood stops moving, it starts getting stagnant, then a clot forms in that stagnant blood. And this disease is not communicable. It's shown not to be hereditary. It's supposed to have developed randomly, and it can be promoted by factors such as obesity, which puts pressure on that area, and sedentary lifestyles. When I developed this condition, I was doing finals, I was sitting at a desk for hours at a time. I think that helped when I was being so sedentary for that blood to accumulate and make such a big clot in my leg. The symptoms of this disorder that I had were the swelling of this leg. It started swelling for about a week. I had calf pain. I thought I had pulled a muscle when I was walking my dog, but it almost felt like a Charlie horse. Towards the end, it started getting worse and worse and worse. And then finally I noticed that my leg was swelling and discolored, and it started looking purple compared to my other one, and that's when I just knew that there had to be something wrong. And then the morning that I noticed that everything was turning purple, I had passed out and actually thrown up, but the doctors didn't have any explanation for the reason why I passed out, but I'm thinking that maybe a clot was thrown to my lungs and caused oxygen starvation or something. It had to do with the condition. And then after all of this and the clot being in my leg, I actually have nerve damage in my foot. It's all tingly, but yeah. In the article, acute bilateral pulmonary embolism in a 21-year-old is May-Thurner Syndrome and are differential by R. Badra in et al. In 2019. They explain that the symptoms of May-Thurner Syndrome by comparing the ones of a deep vein thrombosis, and a left leg deep vein thrombosis is the main symptom of a May-Thurner Syndrome. And they said a more common presentation of the syndrome is deep vein thrombosis of the left lower extremity, characterized by swelling and pain and chronic leg pain, skin pigmentation issues like I had, recurrent skin ulcers may be present in some cases as well. And I didn't have any skin ulcers, thankfully. I think that would be if you had a longer lasting clot in that area that was stopping blood flow. I was treated for this disorder, and I'm now, you could say, about 95% done with treatment. I have 2 more months to go on anticoagulation. When they did my first procedure, they did it without knowing how big my clot was and that I had May-Thurner Syndrome. And they performed a procedure to remove my clot, and it went terribly wrong. The clot traveled to my heart and my lungs, and it caused a myocardial infarction and a pulmonary embolism, multiple of them on both sides. I had lung tissue death called infarction, and my right side of my lung, they didn't know if it was going to recover, but luckily it has at this point. I had to have CPR done on me for 2 hours, and I was put on ECMO for 3 days. And ECMO is a life support system that takes stress off your heart and your lungs by oxygenating your blood outside of your body. Because I only have 6 minutes, I will stop there and tell you that since I left the hospital, I have taken daily anticoagulation medication, and I recently had a stent placed in this past March in my inferior vena cava, and it's to open up the blockage that artery is pressing down on my vein from my May-Thurner Syndrome. That is what it is. And I should be able to stop taking my anticoagulation within 2 months or earlier if they know that I'm not going to develop a blood clot from the stent. From factors affecting the formation and treatment of thrombosis by natural and synthetic compounds by A. Lakota et al. In 2020 states that various methods are used to treat intravascular venous thrombosis, such as catheter-directed thrombolysis, CTS, catheter-directed pharmacomechanical thrombolysis, PCDT, and percutaneous aspiration thrombectomy, which is called PAT, and vena cava filter protection, venous balloon dilation, and venous stent implantation. And when they did my first procedure, I think they used a catheter-directed thrombolysis to go in and break up the clot. They put it through my vein and pushed it up on the back of my knee. And I think when they pushed that through my May-Thurner's blockage, it opened up a passage for all of that the thrombus and everything to go through my body. Luckily, the second procedure went much more smoothly, knowing everything that they know, and it was successful in fixing my condition. And I really hope to bring awareness about this condition. They say that it's more common than we know, and most younger people who develop a DVT on the left side actually can attribute it to this disorder. I hope that you never have to experience what I went through, and thank you for listening.